And I'll hand it over to you, Julie.
Thank you, Karen. Welcome, everyone. It's so great to be with you. Today, we are going to talk about the client need category, specific on the NCLEX exam. So what are we going to learn? We're going to examine the test plan for the NCLEX. We're going to correlate these client needs categories to nursing actions and competencies and generate an intentional shift to foster complex, critical thinking. So let's talk about you for a moment. You may be a new nurse educator and you're transitioning from your clinical practice to that educator role. You may be a seasoned nurse educator. Either way, we need to transform, and this needs to be a transformational process for us. That can be difficult because what we were doing in the clinical practice is going to be a little bit different than what we do in our nurse educator role. So we're going to talk about that today. And Karen and I are going to help you kind of transition and transform. So let's first talk about the NCLEX exam. So as you're coming out of your clinical practice and you're starting this educational role, you may have not even thought about the NCLEX since you took it. So you want to get yourself really familiar with the NCLEX exam, because the ultimate goal is for students to graduate and then take this licensure exam. So what does the NCLEX stand for? It stands for the National Council Licensure Examination. So why is this exam given? I mean, students graduate from a nursing program. Why can't they just go out and practice like a nurse? Well, everyone across the nation is teaching different things. Every state is requiring different things from nursing schools. So the reason candidates have to take the NCLEX is to safeguard the public. We want to make sure they are ready to practice safely. We also need to establish entry-level competencies. You and your clinical practice, your practice as a nurse, you have become an expert in your field. So we need to know, okay, what does that entry-level nurse need to know, and what's the framework for that? And then we want to test the ability for the candidates and these students to critically think, make decisions that have safe outcomes. This is all a part of clinical judgment. Now, the next generation NCLEX, or the NGN, is something new on the NCLEX that was approved and distributed to NCLEX test takers in 2023. You want to get familiar with this next generation NCLEX because it's different than that normal NCLEX that we took in the past. We have new item types, new question types. They're case-based. So there's a case and the student has to answer questions related to that case. So you want to get familiar with that because as an educator, you want to help students to foster that critical thinking, make safe clinical judgments. So let's talk about some NCLEX test plan facts. It's developed by the National Council State Boards of Nursing, or what we refer to as NCSBN. And yep, there's a lot of abbreviations that you're going to need to get familiar with. So what this is a collection of Board of Nursing across our states, the NCLEX Examination Committee, or the NEC, and the results of a practice analysis. Now, the practice analysis is where over 24,000 nurses are given a survey within their first year of practice. And then also the KSA is a survey that we give to practicing nurses to look at the knowledge, skills, and abilities of what a nurse needs. These are all used to determine the NCLEX test plan. There's a framework focus, and the framework focus is on the needs of the client in all settings. Now, this is different, maybe different than what you learned in nursing school. In nursing school, the framework may have been body systems. You learned cardio, you learned respiratory, or it may be curriculum focused. Excuse me. You had your fundamentals class, you had your med-surg class, you had your maternity, peds class. The NCLEX test plan is not using that language. It's using the language of the needs of the client because we want to establish and assess and evaluate, is this student ready to practice nursing? So the needs of the client is the framework. and that's the focus. It determines the content and behaviors that are expected for students to know based on their knowledge base, and the behaviors, the actions that students actually have and the ability to put forth into their nursing practice. It's reviewed and approved every 3 years. So the last year that there was revisions was 2023. So the test plan right now is good till 2026. So let's talk about these client needs category, this test plan. Remember, you're not going to see things like cardio, or you're not going to see respiratory, you're not going to see fundamentals, you're not going to see med surg. So what's the language? Well, there's 4 main categories: safe and effective care environment, health promotion and maintenance, psychosocial integrity, and physiological integrity. Now, 2 of these main categories are broken down into subcategories. Now, if you look to the far right, I've got numbers. I don't want this to confuse you. In the language, and generally when you go to a conference or you go to a webinar or we're speaking the NCLEX test plan, it's referred to the 8 client needs categories. That's based on the main categories and those 2 subcategories from the main categories. So the first one is going to be management of care. That's for the RN. Coordinated care is PN. Safety and infection control is the second one. Health promotion and maintenance, the third. Psychosocial integrity would be the fourth. Basic care and comfort's the fifth. Pharm is the sixth. Reduction of risk potential is the seventh. And the physiological adaptation is the eighth. So whenever they refer to the 8 client needs categories, now you know what that means. It's based on those main categories and those subcategories of the main categories. So let's take a look at this. So the client needs category, there's a distribution, and this is an RN kind of snapshot. On the right, I've got a pie graph, and that pie graph is where the percentage of that distribution is located, right in the middle. But there's always a range for each one of the test plan categories. Now, when we look at this, we've got all 8 that is distributed, and there's different percentages. The top 3 tested client needs category for RN is going to be management of care. So anywhere from 15 to 21% of the items, the questions students get, is going to be covered with management of care. Now, the pie graph shows that right in the middle, that 18%. Pharm is the second highest category, where it's anywhere from 13 to 19%. And physiological adaptation is anywhere from 11 to 17%. Again, the pie graph shows you that distribution in that middle range. Why do we need to know this? Well, if you look at these 3 top categories for RN, that makes up about 48% of the items, the questions the student will see on the actual NCLEX exam. Why is that important? For us as educators, we need to know what are the topics in these categories. I want to get my students ready, because out of all of the 8 categories, these top 3 are almost 50% of those questions they're going to be tested on. So we need to get them practice ready, not just to take the test, but understanding that the whole reason the Board of Nursing, they look at these surveys, what is needed for a safe practicing nurse, entry level. So this is really good information for us to know, because we want to make sure our students know it as they're going through our nursing program. This next pie graph and information is based on the PN, client needs category and distribution. Same kind of method within the pie graph, but the distribution is a little bit different for the PN based on the scope of practice and those survey results of what those students need to know, and those skills and those actions they have to be able to actually demonstrate and show to be a safe practitioner. So coordinated care is anywhere from 18 to 24%. And on the pie graph, that middle range is 21%, which is almost a fourth of the questions they're going to see in NCLEX Day. Pharm is 10 to 16, and safety and infection control is 10 to 16%, which on the pie graph is 13% for both. So this is important information that we need to know as we're educating those RN students and those PN students. Why do you need to know this? This is a lot of information, Julie. A lot of you are thinking, well, I'm not teaching like leadership or the capstone course, so I don't need to worry about this unless I'm teaching that. This is not true. If you're teaching fundamentals, you're teaching foundations, you're teaching health assessment, it's important right here, right now. We want students to get ready, practice ready day one when they step into nursing school. Because the ultimate goal is for them to graduate and be able to go and transition into safe nursing practice. That starts day one in your nursing program. So this test plan provides us that roadmap of what is the content that's going to be tested on the NCLEX. What's the skills needed that students need to demonstrate on the NCLEX? What are those behaviors that are expected from the student? What's the actions that are required from the student for entry-level safe practice? Now, I've got this turtle on the slide because you as practicing clinicians out there practicing, you're able to make decisions very quickly, but students aren't. So this is a slow path for them, and we've got to guide them. One thing you'll need to do is kind of step back and think step by step, how do I think to be able to make decisions that are safe? And when you do that, you're going to be able to help your students do it. And that's what we want students to be able to do, make safe clinical judgment, safe decisions. So let's look at each one of these test plan categories. And I'm just going to give you a snippet of some of the topics and concepts under each category. We all know what's under cardio. We know what's under respiratory. We know what's in the PEDS class. But do we know really the topics that are being taught for each one of these test plan categories? So let's look at management of care, coordinated care. This is topics related to advocacy, privacy, confidentiality, prioritizing care. So you just received a report, you've got 5 patients. Who are you going to go see first? Who are you going to go see second? Who's the most unstable client? Continuity of care, delegation, assignment, scope of practice, advanced directives, informed consent, ethical practice, and ethical decision making. Collaboration with the interdisciplinary teams, case management, referrals, resource management, quality improvement. So there's a lot under that management of care and coordinated care client need category. We always want to think about the client need, not just here's the content, here's what you need to know, but how are we going to take care of the client safely? Farm, now this one's kind of pretty easy. We kind of understand what's under farm. So this includes our dosage calculation, medication administration, farm pain management, blood administration, TPN, CVAD for our RN students, expected actions, adverse effects, contraindications, side effects, and those interactions. Physiological adaptation, now that's not we're not real sure what could be underneath that category, but I want you to think of physiology and pathophysiology, how the body works, how the body's going to respond to disease. Those are those concepts and topics under that category. So this includes patho. It includes illness management, medical emergencies, alterations in body systems. So the body's not working right, what's going on? Unexpected responses to therapies, fluid and electrolyte imbalances, and hemodynamics. Our next category is safe and infection control. Now, this seems relatively easy, but it's everything under safety and infection control. I also want you to recognize that you're not going to see PEDS on here. You're not going to see OB kind of content in one of these categories. So it's about taking care of the needs of the client across the lifespan in each one of these categories. So you could have a PEDS patient in management of care. So a lot of times students come back to you and say, oh, my NCLEX, it was all OB questions. Well, we know that's not true because we know the 3 top tested categories on the NCLEX, and it's not specific PEDS, it's not specific OB. It's related to those 3 top. So safety and infection control includes accident, error, and injury prevention across the lifespan, safe use of equipment, restraints, home safety, reporting of incidents and events, Ergonomic principles. And this comes back to you maybe being a fundamentals teacher or you being that foundations teacher, and you're teaching body mechanics, you're teaching safe transfers. That's on the NCLEX. So this is part of the NCLEX. So get out of your mind, I'm not teaching that leadership course or that capstone course. I don't need to know about the NCLEX. You do. It's important. Handling hazardous and infectious materials, triage, evacuation procedures, emergency response plan, security plan. Standard precautions, transmission-based precautions, and surgical asepsis. So remember, all the courses that you're teaching are building upon one another, especially fundamentals. Firm foundation for your students to continue to build and build critical thinking and clinical judgment for safe practice. Reduction of risk potential. Now, this one's a hard one. What concepts, topics are being taught or needed to be demonstrated? Therapeutic procedures, system-specific assessments, diagnostic tests, lab values, vital signs abnormalities, potential for alterations in body systems, and potential for complications from anything. Surgical procedures, treatments, health alterations. I'm not including every single topic on these slides. I'm just giving you a little snippet. So it's really important you go to the National Council State Board of Nursing, look at the test plan, and look at everything that's encompassed in each one of these categories. Basic care and comfort. This is related to elimination needs of your client, comfort measures in your client, nutrition and oral hydration, personal hygiene, rest and sleep, mobility and immobility, and assistive devices. Health promotion and maintenance. Now, when you think about health promotion maintenance, this is a hard one to kind of determine what's in here. But think about growth. Think about health. And that's why I gave you the picture of this plant, because that's what this category is all about. Aging process, health promotion, disease prevention, developmental stages and transitions, antepartum, intrapartum, postpartum, newborn care, self-care, high-risk behaviors, lifestyle choices, techniques of a physical assessment, health screening. Those are things that are taught early in a nursing program. Those are things that are going to be tested on the NCLEX. So remember that firm foundation. And then our last category is psychosocial integrity. Now this one's kind of easy for us to kind of grasp what topics. This is abuse, neglect, therapeutic communication, sensory and perceptual alterations, cultural awareness, cultural influences on health, family dynamics, religious and spiritual influences, coping mechanism, crisis intervention, grief, loss, stress management, mental health concepts like bipolar, schizophrenia, and chemical and other dependencies related to substance abuse. That's a lot. And this can be very overwhelming. But it's important that you understand the NCLEX and how the NCLEX is testing the student and overall why the NCLEX is doing it, why we have to take this licensure exam. It's for safe practice. So as an educator, you want to advocate for safe practice. You want to teach safe practice. So how are you going to use it? Use the NCLEX test plan on these client needs categories as your starting point. It's your guide. Students are overwhelmed with all the information you give them. They don't know what's important, not important. You know what's important, the test plan for the NCLEX, because that's ensuring we've got safe practice. They're ready to practice safely. So use it as your guide. Align your learning objectives with the test plan. Invest your time to understand it and learn the language and talk the talk. When you're with your students in your classroom, talk the talk, the language of the test plan. Cover content, skills, behaviors, and actions that you know the student needs to demonstrate on the NCLEX, because that's the most important in the topic that you're teaching right here, right now. So instead of just saying, here's Crohn's, here's the signs and symptoms, here's what you're going to do, get your students to think, engage the learner. Don't just spit out the information and expect them to spit it back out to you. Really have them think through it and help them know those skills they're going to need to know to take care of that client safely based on the client's needs with Crohn's, not just the disease process. Develop quizzes and exams to evaluate their performance. Again, use the language of the NCLEX. How's the NCLEX going to ask them? Most important, priority action. Provide feedback for reflection, growth, and progression. Not only this feedback to your students, but feedback to you. Evaluate how you're doing, really helping the student to that practice ready in every single course you're teaching. And stay up to date with the National Council State Board of Nursing. So this is transformation. We talked about your transformation at the beginning of the presentation. Now I want you to think about transforming your students, not just learning content and spitting the content out, but really concentrating on clients' needs when you're teaching all of these diseases. When you're teaching anything, think, what is the client's need in this situation? Avoid just straight lecturing for 3 hours. Avoid teaching to the test. Don't give them all the answers. Allow them to be curious and explore the answers themselves. Focus on practice application. Really have good activities for reflection, self-reflection, and peer reflection. Students can learn from other students. Have them debate. Why would you do this? Why wouldn't you do this? Allow students to think and process the information. Provide prompt feedback. So right here, right now, while they're in your class, gently provide them feedback if they're not thinking in the right direction. Consider pre-class preparation. They come to class ready, so that way you can engage them in learning activities, and then make sure you have some post-class reinforcement. How can you do this? Virtual simulation is great. We think of virtual simulation as clinical replacement, but bring the virtual simulation into your classroom. It's safe to make mistakes. It helps them think through taking care of a patient. And then it provides you an opportunity to give them feedback right here, right now. Include Socratic questioning into your students. Mimic it. So when students go to study on their own, they're asking these same curious questions. So have thought-provoking dialogue in your classroom. Why would you do this? What would you do? How would you do it? When would you do it? So really getting them to think. And then include unfolding case studies. If you're coming straight out of clinical practice and becoming a new educator, you just have a lot of case studies just in your memory of taking care of patients. Write them down and have them unfolding. So here's the case, this is the patient, but then something happens. What are we going to do? So really get your students to think of practicing as a nurse and thinking like a nurse. Now, this slide I wanted to show you. It's a busy slide, but I wanted to show you, and I wanted to give a shout out to our content, product, and curriculum team. Because after a student takes our practice questions or they take an integrated test, we provide them an actual report of how they're performing in each one of the test plan categories. We even show them per question what test plan category that's under. This is great because they can start right day one in the nursing curriculum. When you give them a fundamentals Kaplan exam, they can see where they're at. We have a content review guide, and each one of the chapters is a client needs category. So if they know they're weak in management of care, they're weak in safety and infection control, they're weak in pharm, they can go right to that content review guide and look at the information. We also provide blueprints to our faculty on our exams, and we break down that distribution of the client needs categories. At the top right of the slide here, we have our channel presentations. Students can attend live or watch recordings. We provide a case study. We talk about the content, and then we have an NCLEX style question that we do with the student. So we're applying, getting the student to think that clinical practice. And then also our virtual simulations. We have mid-fidelity simulations, and we have our iHuman simulations, which really help to engage the student with critical thinking and clinical judgment. Here's the references, and when you have that opportunity in the next couple of days, when we post the recording and the slides, you'll have direct links to about the NCLEX exam so you can learn about it, frequently asked questions, preparing for success. Now, this will give you information kind of on the student side of things, and it has a sample test, so you can look at that verbiage and that language. Go to the NCLEX test plan and look. It'll give you kind of objectives, what the student needs to know, the skills they need to know, all the actions they need that's required of them. And then subscribe to the NCSBN mailing list. You don't have to pay anything, but give them your email and they will keep you up to date on anything they up to date. So that's a great way to keep up to date on the NCLEX. This is all the information I had. I know it was fast and furious, but I really want you to think about using the NCLEX test plan and client needs categories to guide your teaching of the topic and really think about client needs and get your students to think about client needs. Karen's going to put that evaluation in the chat, and looks like Karen has. I also want to let you know our next presentation at Kaplan is going to be April 9th with Claudia, and we're going to talk about test analysis. Any questions?
Great job, Julie. We haven't had any come in, in the chat, which is great. I agree, it's a lot of information, but it's important that every faculty member know this and start implementing at all levels, like you stressed, from fundamentals straight through the curriculum. So great, thank you.
Yeah, and it's hard. It's so hard when you start out as a new educator and you don't know where to start. Go to the National Council State Board of Nursing, look at the test plan and look at all the information they give you. And that's going to tell you what is priority for me to teach about each and every topic that I'm teaching. Go look it up, and that's your starting point. And then you can have learning activities around that. Plus, you have to look at your curriculum at your school too, and all the objectives and all the learning outcomes that they want. But make sure that you're really engaging in that process. Think about the end goal of the student. They need to pass the licensure exam, but more important, they've got to practice safely.
Great, thank you. And if everyone before you log off today, if you could just click on that link and please do the survey for us. We love feedback. We want to make sure we can improve these and give you everything that you want during the presentation. And we thank you for joining today.
Yeah, and the survey will also give you a certification of attendance. So once you fill that out, you'll get that certification. So just give us a few moments to fill that survey out and give us your thoughts. Well, Julene, do not fill it out while you're driving, for sure. Keep yourself safe. But if you fill that out, you'll get that certification of attending. It's right here in the chat. So Karen's posted evaluation link. That's the survey. So you should be able to click on that and go right to that form. And Julene, we could do that if you can. You might not want to put your email while you're driving, so we don't want you to do that either. But Julene, you can reach out to me at julie.hamilton@kaplan.com once you get somewhere.
Yeah, I just put it back into host in all panelists. Let's see.
Yeah, it's here we go. I'll try to post it too. We'll both do it.
Yeah, it says to everyone, so hopefully.
There you go. I just posted it, and so did Karen. Do you now see it? You see it now. Okay, okay, awesome. Very good, very good.
Gotta love technology. Yeah, we appreciate. Thank you very much.
Yeah. And thank you all for letting us know. You are welcome. Let us know if you have any questions. You can put them in the chat. And remember, the recording and the slides will be available. So you'll have that. It usually takes a couple days, 48 hours. But you can go right back to the registration link where you registered. And that's where the recording and PowerPoint slides will be.